Hi all, welcome. We're going to give it just a few moments to make sure that we have everyone in attendance. But first, thank you so much for being here. I see some folks filing in. In the meantime, for those that are joining, we are enabling French and Spanish translation for today's webinar. If you would like to go ahead and enable that, if you go to the bottom right hand of your screen, you will see the option More. It will be a circle with 3 dots. Click on that. The top option is interpretation, and you can select your language using that option. All right, I think we can go ahead and get started. Again, welcome to today's webinar. For close to 60 years, PAI has been championing sexual and reproductive health and rights as essential to development progress, including the achievement of health equity, gender equality, and economic achievement. In addition to PAI's advocacy and accountability efforts targeting the U.S. government and international institutions, PAI provides funding and support to community-based organizations in over 35 countries that are working to advance SRHR priorities in their own countries and further fuel a global movement grounded in the agency, autonomy, and human rights of women, youth, and at-risk communities around the world. Today, we'll be discussing the global implications of the 2024 elections in the U.S. for sexual and reproductive health and rights, including U.S. policies, programs, and the implications on the global stage and with multilaterals. There's still a lot we do not know regarding who will be in key positions, the specifics of day one policies, etc., but we are eager to share what is known and to reaffirm PAI's role in fighting for rights globally. You will have the opportunity to engage today, so please share all of your questions for the speakers using the Q&A function at the right of your screen on Zoom at the bottom. And again, as I said, you can enable translation in French and Spanish by clicking on the button that says More, that is the circle with 3 dots. Click that, select interpretation, and then you can choose whether you would like to hear the webinar in Spanish or in French. We will also be recording today's webinar and sharing the link for your reference after the fact. So today we're going to hear from 2 of PAI's experts. The first is Mustafa Kudrati, who is our Senior Vice President of Program Strategy and Growth. He has held senior executive roles at JSI, Plan International, and Gender Health and Pathfinder International, managing health development and SRHR service delivery and advocacy programs worldwide. He has extensive experience on the program implementation side of things and direct experience in navigating harmful U.S. policies like the Global Gag Rule. We'll also be joined by Rachel Clement, PAI's Senior Director of U.S. Government Strategy, where she advances PAI's goals of universal access to sexual and reproductive health and rights, and works to ensure that perspectives from a diversity of voices from low and middle-income countries are centered in decision-making processes in Congress and the U.S. administration. She has received her master's in international development studies from George Washington University and her bachelor's in sociology from the University of Colorado. So thank you to both of them for joining. So now we're going to go ahead and dive in. I'm going to turn now to Rachel Clement to highlight the changes that are about to occur in the U.S. government and legislature. Rachel, over to you.
Thanks so much, Katie, and thank you to everyone who is online right now joining us as well. So as many of you already know, the Trump-Vance administration will be taking the White House in January. They're part of the Republican Party. The same party controls the Senate and the House, our two bodies of Congress. This is very similar to the situation that we saw in 2017 when the first Trump administration took office, but things are very different now. During the time that Trump had the trifecta of the White House, Senate, and House in 2017, the individuals in the administration and in Congress were seen to be sort of moderating factors and aligned with a more traditional Republican Party that supported foreign assistance and foreign aid, family planning as well. The current alignment of members of Congress and individuals sort of in the administration, in addition to the president and vice president, are going to be much more aligned along a conservative anti-choice, anti-rights agenda as part of a central tenet of US foreign policy. It's helpful before we sort of dig into what the elections mean, what may change, to just ground this discussion in the fact that there are a number of statutory restrictions that are in place regardless of administration. The Helms Amendment has been in place since 1973 and restricts the ability of US funding to be utilized for abortion services, counseling, or referral. According to the Kaiser Family Foundation, 86% of countries receiving US global health assistance allow for abortion in at least one circumstance. The Helms Amendment still aligns those countries with US policy and not their own if using US funds. So it is sort of already negatively impacting global SRHR and sort of full universal access to rights. The good news is that the US House of Representatives passed the fiscal year 2022 State and Foreign Operations Bill with language that did not include Helms. And there has been a lot of push here in Washington to repeal that. We'll get into sort of what's likely in terms of legislation with this makeup of Congress. But just to note that that is a harmful policy that is already in place and will remain in place. Similarly, SILGANDR has been in place since 1981, and it states that in theory, no US administration should be able to lobby for or against abortion in other countries. It is traditionally only applied to one half of that equation. And one thing that we would love for partners on this call to consider is just documenting if and where you're seeing the US government lobbying for or against abortion, because that is statutory language that is already in place, and the United States government should follow the law to the full extent, sort of on both sides of that equation. And then finally, the Kemp-Kasten Amendment that has been included in foreign assistance language since 1985. It doesn't explicitly call out UNFPA, but it has only ever applied to UNFPA. There's ostensibly an evaluation that occurs by the US government to determine whether Kemp-Kasten should be in place to defund UNFPA, but evaluations by the US government and others have found no evidence to justify the imposition of Kemp-Kasten. So that is just something that will likely come into play. Next slide. So here's what we know, and there's a lot that we don't know. And just to sort of ground this discussion again, to say that the Trump, we only have one administration at a time. So right now, President Biden is still the president, and all of the rules and policies that that administration has put in place remain until January 20th, when Trump takes office. So we don't know for sure what the new administration is going to bring and what they're going to do. However, they have signaled a great likelihood that they're going to reinstate the global gag rule. My colleague Mustafa will go into what that has looked like in the past, but they expanded it drastically under the last administration, and we anticipate attempts to expand it even further, which would impact which funding recipients and which pots of funding are impacted. We also anticipate attacks on foreign assistance broadly and international family planning and reproductive health specifically, both within Congress and from the administration. We anticipate that UNFPA will be defunded again under the Kemp-Kasten determination, and that other UN agencies engaged in global health and comprehensive sexual education will also face threats of defunding, such as the WHO and UNESCO, UN Women. And we also anticipate that this new administration is going to re-engage in the so-called Geneva Consensus Declaration, reestablish the U.S. Commission on Unalienable Rights, and push the use of Protego standards. These are moves that came into play during the first Trump administration. The Geneva Consensus Declaration was originally signed by 32 countries. Its central claim is that there's no international right to abortion. Its supporters hope to remove sexual and reproductive rights from the UN agendas and at the OAS. It puts the anti-rights agenda ahead of all other considerations and undermines multilateral governance. The declaration has no enforcement power, and many of the signatories have very problematic records on human rights, particularly for women's rights and LGBTQ rights. The Protego standards are a project from the architects of that Geneva Consensus Declaration to operationalize an anti-science and anti-rights education, health, and foreign policy agenda. They've launched it in 2 countries and have stated that they have at least 15 more that are considering implementation. The package of implementation includes tools and training to ensure governments discredit and work against women's human rights defenders, and both within their countries and globally through multilateral fora. And finally, the Unalienable Rights Commission was a body established during the last Trump administration, again, to just redefine which human rights are human rights and to undermine through US foreign policy, both what we determine to be human rights and what we recognize in multilateral fora and bilateral agreements as human rights. So those are some pretty big threats, but we will be monitoring many others. There have been a lot of theories circulating, and we don't want to be overtly alarmist, and I do not have a crystal ball, so I don't know for sure what the new administration will bring. But we do have some signals that there's a potential threat that the new administration will prioritize funding for groups that do not promote full contraceptive method mix or who don't serve adolescents, young or unmarried individuals, and will instead prioritize married heterosexual couples and prioritize abstinence only and natural family planning methods, which we know to be less effective and we know are not, a full method mix that serves everyone and all of their needs. We have also heard some serious threats against LGBTQI rights organizations. We saw during the last administration that many career staff left executive agencies as they were unwilling to implement policies from the last Trump administration. We anticipate that this may happen again. There have also been some calls during the campaign by the Trump campaign to severely cut the number of civil servants and career staff. So there could also be sort of mass firings and just less staff to implement US foreign policy and foreign assistance. There have also been talks of creating new agencies, new high-level positions, again, to really center and elevate this anti-rights agenda as a core part of US foreign policy. And we do know from past administrations that have implemented the gag and the last Trump administration that there is a real risk of over-implementation of rules and policies and a chilling effect that can happen beyond even the policy's stated intention. And finally, there is the opportunity with the Republican control of the House and Senate to codify the global gag rule, which would make it a permanent policy of the United States government rather than something that changes when Democrats and Republicans control the White House. I'm going to hand this now to Mustafa to talk about potentially the biggest threat we're facing.
Thanks, Rachel. And I'd like to start by just quoting a colleague of ours whom you'll meet later during the Q&A session, Craig Lasher. And Craig likes to remind us all that while everything we're sharing right now is couched in anticipation, this is what we're watching, one thing we can be fairly certain about is, like death and taxes, the reinstatement of the global gag rule is virtually certain and will be one of Trump's first official acts after the inauguration on January 20th. Like George W. Bush in 2001 and Trump in 2017, it's a day one agenda item, and we should anticipate that flowing down the line. Just as a reminder again, that prior to Trump, the global gag rule was only implemented on USAID's family planning and reproductive health assistance, which has totaled roughly around $600 million over the years annually. Under the first Trump administration in 2017, it was expanded to all global health assistance and ended up affecting over $7 billion of US government funding annually and implemented on it. And then in the second Trump administration, as Rachel alluded earlier, there is a lot of talk about expanding the global gag rule to cover all of US government's foreign assistance budget, which would mean it affects an envelope of $51 billion, including humanitarian assistance as well. So this next couple of slides are just to give you a sense of the size of the pie that US contributes towards in terms of bilateral funding. This first diagram just shows that the US government contributes over 43% of all funding for family, all bilateral funding for family planning, including funding to UNFPA. And this is what may be under threat or would have the global gag rule imposed on it. And then when we then shift over to take a look at bilateral assistance for global health in general, then the size of the US pie is a little harder to calculate, but we know it's at least 32%. But then if we include the US government's contributions to the Global Fund for AIDS, TB, and malaria, to the World Bank, and Gavi, that contribution goes up and probably constitutes over a third, possibly as high as 40% of all bilateral funding. And as a result, the reason we're bringing this up is just to demonstrate that a change in the US government policy, as many of you are very well aware, ought to reimpose an expanded global gag rule, ends up having an enormous influence on the global health landscape. And if it's further expanded to include all foreign assistance, then it has a massive and much bigger effect across the world as well. So just a little bit, and bear with us, please, as we go through some of these slides. What does the expanded global gag rule do? In essence, the policy applies to all non-US for-profit and not-for-profit NGOs that are not organized under the laws of the United States. It requires all non-US NGOs receiving virtually any form of US global health assistance it prohibits them from performing or actively promoting abortion as a method of family planning, even with funding from other non-US government sources. The restricted activities under the policy include, but are not limited to, abortion care in cases other than life endangerment, rape, or incest, counseling, including advice or information and/or referral for abortion, and lobbying to make abortion legal or more available in an NGO's own country. The expansion of the policy is explained well by the diagram on this slide. Take a look at the diagram on your left first. Before PLGHA was imposed under the first Trump administration, the global gag rule applied only to foreign NGO recipients or implementers of the US government's family planning and reproductive health funding, and prohibited these NGOs from performing or promoting abortion as a method of family planning. So if an organization was implementing other health or development programs, then the global gag rule did not apply. With the changes brought about under PLGHA or the expanded global gag rule, it now applies to all US global health assistance. So for example, a non-US NGO implementing a malaria program with US government funding, either as a sub or a prime, would get PLGHA attached to all of its programs regardless of funding source. If PLGHA is further expanded to include all US foreign assistance, then the provisions will apply to all programs implemented by non-US NGOs as long as they receive even a tiny amount of their total funding directly or indirectly from a government source. So as you can imagine, the reimposition and probable expansion of the expanded global gag rule will have a tremendous effect on people around the world. From the last time the global gag rule was imposed, we can anticipate the impact in at least 4 broad categories. Many of you and your sister organizations will have to make difficult choices to either comply with the expanded global gag rule and as a consequence curtail abortion services or advocacy funded by non-US government funders, or lose all US government global health funding, or even possibly any US government foreign assistance and maintain the abortion services. You're being asked to make an either-or decision coming forward once the rule is applied. Per the earlier slides shared, given the US government is the largest funder of global health assistance, and even more so of family planning and reproductive health funding worldwide, you're being asked to make some very, very difficult decisions. So as a result, we do note that US government programs that are led by non-US based organizations will end prematurely. It will result in significant program and service disruptions in family planning, HIV, TB, malaria, and others in multiple countries. And this will affect partnerships between US-based and non-US-based organizations and potentially increase distrust in the localization efforts as well as in the journey to self-reliance. We also know that local anti-choice, anti-LGBTQI advocates will be emboldened and pro-choice voices will be muzzled in health, democracy and governance, gender, women's rights, economic empowerment, legal engagement, and responses to GBV. And that pro-choice voices in exchange will be muzzled. And this will be even more drastic if conditionalities are attached to government aid, meaning national government health services may also be forced to choose between provision of a full range of SRHR services where permitted or reduce coverage to meet the conditionalities. We will, and we have seen in prior impositions of the global gag rule, disruptions in evidence-based or evidence-informed policymaking. In many countries, a number of large national NGOs receiving US government and other donor funding decided, this was under the last global gag rule, they decided to stop supporting or advocating for increased access to quality abortion services as a response to address maternal mortality and morbidity in their countries. And those NGOs left those efforts and have not returned back even under a favorable Biden administration. A study by the Foundation for AIDS Research found that 1/3 of 16 PEPFAR implementing partners altered their organizational operations or service delivery in response to the last time the global gag rule was imposed in 2017, and that young women, LGBTQI people, and sex workers were the worst affected by these changes. We also, under the last imposition, we also saw a return of abstinence-only programs, which have plenty of evidence, as most of you know, have plenty of evidence that they do not work and actually result in an increase in unwanted pregnancies, and yet we saw a return to that. In Uganda, we witnessed an expansion in the promotion of abstinence-only education programs by senior government officials. And the reimposition of the GGR, coupled with the ban on comprehensive sexuality education and limitations on what information services are offered to youth, almost certainly increase unintended pregnancies. It goes without saying that in addition to the effects on NGOs, sovereign voices, and the chilling of pro-choice voices, the reimposition and or expansion of the expanded global gag rule will also affect services delivery. With funding of about $160 million for UNFPA at risk, that's the amount that the US government contributes annually to UNFPA at present, we can anticipate significant disruption in supplies of contraceptives worldwide, and therefore we can expect unmet need for modern contraceptives to increase. We also know that access to quality SRHR services will go down significantly. In the last Republican administration, reimposition and expansion of the global gag rule resulted in the immediate halting once the gag rule was imposed on the local organization. So it took a while, but once it was imposed, it led to the stoppage of mobile reproductive health services for tens of thousands of women in at least 7 West African countries: Senegal, Mali, Niger, Burkina Faso, Benin, Togo, and Cote d'Ivoire, because the main partners who were implementing the mobile health services did not sign the global gag rule, resulting in the termination of those services to all the women. In addition, in Nepal, the imposition of the global gag rule resulted in termination of services contributing to more than 60,000 couple years of protection annually, termination of employment for 80 staff, and over 250 trained staff in health facilities were no longer able to provide services. And that led to a quick loss in skills. And when the program was reinstated, they had to retrain everybody at enormous cost. We also know, because of the things that Rachel also commented about, the over-interpretation of the rules, that access to legal and safe abortion services will be reduced. We have very clear evidence from Ethiopia, where access to high-quality safe abortion care is legal, that abortion services were curtailed as many organizations were unable to maintain both the US government funding and abortion services, but also because providers, even in government health facilities, became very wary about offering referrals for abortion services when asked, even though the gag rule did not apply to their services. They nevertheless ended up gagging themselves as an overinterpretation. And then finally, the compliance burden go up tremendously. Everybody has to comply. So I was in Tanzania, and my teams and I were in the forefront of the compliance burden in 2017, the last time the global gag rule was imposed. And I can tell you directly from experience that the cost in terms of time, staffing, financials went up significantly to meet the substantial burden of ensuring compliance with the policy. And that resulted in less funding to advance family planning or reproductive health access. If the expanded gag rule is expanded even further to include all foreign assistance, then people outside the health sector will have to be trained annually, resulting in even further thousands of hours of time spent on compliance rather than program implementation. So, amidst all of this doom and gloom news, things that we're anticipating, what is PAI preparing to do, and what are we committing to? We're committing to keeping up the pressure on Congress through advocacy to adopt SRHR legislation, to fund bilateral and multilateral family planning and reproductive health programs, and permanently repeal the global gag rule. We would like to note that we will do this even though the chances of moving this part of the agenda forward are slim given the overall makeup of the administration. We also want to say we felt that we were fighting overwhelming odds last time in 2017 as well, but the combined efforts of activists on the Hill did result in the maintenance of the family planning and reproductive health budget, which the Trump administration had the first time over, when they sent in their first budget, had suggested it should be zeroed out. We will also continue to introduce new legislation and find innovative ways to insert our agenda into existing legislative vehicles. We'll engage in collective action through the civil society coalitions that we both lead and those that we participate in, recognizing that our voices together are stronger than each of us alone. We'll also attempt to rebuild bipartisan support across the US government to maintain international family planning and reproductive health budgets. We're looking into reviving the sponsorship of congressional and staff delegations so that there are more people on the Hill who witness the benefits of all US government programs down the line as well, and have them be our allies in pushing back against harmful policy proposals. We'll continue to ensure that evidence-based data collection documents the policy impact through our Access Denied series. And then we'll fund, also are committed to funding coordinated advocacy and accountability efforts in the Global South countries to mitigate the policy harms that are being done with the imposition of the global gag rule. And finally, we're committing to continuing to be a source of clarity and information for non-US NGOs. An example of a resource that we already have in place is the site globalgagrule.org, where there are helpful resources providing unofficial explanations of new rules, and where we will be posting the effects of the global gag rule by updating our Access Denied series of publications. We will also continue to regularly issue our Washington memo as a source of information on what is happening on the Hill. And most importantly, we will be working with you in solidarity, making sure our collective voices are heard everywhere and that despite the strongest attempts, our voices are not silenced. In addition to these actions, here are some recommendations on what the global civil society community can also do. One is just document, and you've done this brilliantly over the years whenever the global gag rule has been reimposed, is to document, brief us on how the changes in US policies are affecting services and policies on the ground, including the reimposition or expansion of the global gag rule, the defunding of the UN agencies, and violations of the SAIL Gender Amendment as well. We would also like you to really engage with USAID and CDC missions and embassies on the ground on the impact of conditionalities and ongoing US government funding and support. Continue to uplift your stories and stay in touch with PAI. Brief the embassies, brief USAID about the effects the policies are having on programs and access to programs on the ground. We would, we imagine that you'll continue. You've all been very, very active in engaging in collective action through your own civil society coalitions, both at the national and regional level. And we anticipate that you will be continuing to push that collective action through. And then lastly, and I was in a webinar that was organized prior to the elections where a colleague of ours from Afyana Haki in Uganda spoke about the need for national and regional organizations to also continue to maintain and continue to coordinate advocacy against any attempts or caving of governments against sovereign action, right? So if the US government says they're going to impose even further conditionalities on aid to countries in the global south or in LMICs as a condition of receiving US government aid, to push back through legislative action, through action at the African Union, and hold their governments and legislatures accountable to the concrete commitments they've made, and against the kind of Geneva Consensus documents that Rachel talked about, but to also hold them accountable to commitments they've made through the Maputo Protocol, the Abuja Accords, the FP 2030 commitments, the Lusaka agreements, and many other commitments that they've made very verbally and have put them out there as well that are pro SRHR access worldwide as well. I just wanted to also use this time to introduce you to our speakers. Katie Anthank is our Director for Strategic Communications. Rachel and I have already been introduced, and you'll be meeting Craig Lasher, who's the Senior Fellow and US Policy Analyst at PAI. We encourage you to keep contacting us if you have any further questions. If you have insights into what's happening on the ground, please do not hesitate to reach out to any of us. We would like to continue being a resource to you and to also hear from you. And then finally, for our CEO and President, Nabihah Kazi Hutchins, we want to also take this opportunity to reaffirm PAI's firm commitment that irrespective of political shifts in the United States, we will remain steadfast in our shared mandate and resolute in our collective voice. PAI will remain ever vigilant, collaborative, and hopeful. And with you, we will uphold our values on reproductive rights and deliver on what communities around the world have entrusted PAI to help advance for all people in generations to come. Thank you. I'm going to hand over to Katie to moderate the next part of this session.
Thank you so much, Mustafa and Rachel, for your presentations. Just a reminder to our attendees, you can now ask questions using the Q&A function on the bottom of our screen. So as folks are filling that out, I'm going to start with one initial question. And I think this will probably be for Mustafa. So first, I know you said not to change any practices right now for NGOs, but what preparation and thinking should implementing organizations take on to prepare for the reimposition of the global gag rule in January?
That's a great question. Thanks, Katie. And I might invite Craig to add to this as well. But I think a couple of things, okay? Right now, do not take any action. You do not need to take any immediate action In fact, even after you hear about the reimposition of the global gag rule, there's a procedure that has to be followed. It has to be once the global gag rule is the executive order is signed, it has to go through internal USAID and CDC and Department of Defense systems, and then they have to amend their agreements with their prime recipients. That amendment has to come through. If you're not a prime recipient of US government funding, but are a sub-recipient through a prime, the prime then has to impose the conditions on you. It takes time, take full advantage of the time it takes to reimpose these conditions. Having said that, what you could do is examine, take a look at your portfolios, brief your boards, take a look at your portfolios and anticipate, is there change that's going to be needed? Because these are conversations that you may want to consider having at a minimum with your boards if there's going to be a change in the makeup of what your organization chooses to do or how it is choosing to move forward with its mission as well. So just to let you know that's just in consideration, but please don't take, don't this is back to Rachel's point, don't overinterpret, wait till the rule is actually imposed on you. It is not a rule until it's formally, officially in an agreement and you've been told sign or choose not to sign and lose the rest of your funding. So that's when it will come down to you. Craig, I don't know if you wanted to add anything to that, but
just a little bit more on timing, perhaps. So as Mustafa said, we fully anticipate that there will be a presidential memorandum directed to the Secretary of State, the Administrator of USAID, and the Secretary of Health and Human Services to impose the gag rule. But it will take several months for those departments and agencies to produce the standard provisions that will be included in assistance agreements. For example, in the last iteration in 2017, it took the U.S. government until the end of March of 2017 to formally issue the standard provisions. And then, as Mustafa said, they were only applied when there was a new funding agreement or additional funding was added to existing agreements. At least in the past, they didn't attempt to apply it retroactively to the presidential memorandum or even the issuance of the standard provision. So you have some time and wait till you get some sort of official notification before you change what you're doing.
Thank you both so much. So we have a great question that just came in from Kimberly Whipke. First, she thanks all of you for the presentation. Her question is, given the looming cuts to U.S. foreign assistance, and specifically international family planning and reproductive health, and recognizing what a significant share of funding the U.S. represents in global health, who do you see advocates targeting, whether it be other donor countries, private sector, et cetera, to mobilize resources and address the projected shortfall in funding? So open to the group, whoever wants to jump in first.
Rachel, do you want to take that on?
Craig and I can tag team this. The news isn't great. I don't think that there is a Superman to save us all here. A number of other donor governments have indicated that they don't have the ability or willingness this time around to step in a major way. Governments have also shifted since the last time that the Trump administration was in office. And so I think the news is not great. I don't think there is sort of a way to completely fill that gap. I don't know, Craig, if you want to add more there.
Well, in light of the significant gains in the stock market and presumably the portfolios of a number of foundations who have been active in this space. There ought to be additional resources available if foundations are willing to commit to trying to make up for the shortfall. It is family planning, reproductive health programs have our own particular set of issues, but there's pressure on the U.S. foreign assistance budget as a whole and the global health budget within that. So, we have our own unique problems, but we're also affected by larger trends in U.S. foreign assistance. But hopefully we can look to some of the traditional foundations and maybe some new foundations to step up and try and make up some of the shortfall. But as Mustafa pointed out, the U.S. government is a huge donor, and it will be challenging.
Thank you. We're getting a lot of questions, so we're going to try to get to all of them. So the next one we have from an anonymous attendee asking, how do you see the trend of philanthropic agencies in countries where governments apparently align themselves with Trump? So what kind of trends? Maybe Mustafa, we can start with you.
Sure, I'm trying to understand the question fully as well.
Yeah.
And I think yes, and I think this was something that we tried to allude to about some of the effects that when the global gag rule and other conditionalities start to get attached, when a U.S. government that is so anti-choice and anti-rights comes into place, we do see an increase in emboldening of anti-choice, anti-rights voices in other countries as well. So it's something that we have to really keep watching, seeing what the kind of multiplier effect is of having such a strong voice, and both to keep documenting it and make sure that we are, to the extent possible, we're bringing through the kinds of resources needed so that we're able to counter that voice. And the voice is actually very well funded, right? So many of you are probably familiar that even prior to taking office, Trump has already been meeting with some of the most conservative leaders in Latin America, for example, and they've been meeting and taking phone calls throughout. And I think part of it is to advance some of the more conservative agendas, right? Argentina, which has a very progressive SRHR law, the current president had a substantial phone call with Trump very recently, and he's another populist who's trying to move things forward. Bolsonaro went ahead and was one of the first people to congratulate President Trump on his victory, and is moving things forward and seems to be camped out in Mar-a-Lago all the time, even though he's not in office. Okay, so I think there's a lot going on that we have to watch for, and I think we will get pushback, and we would really both love to hear from you, but also as a global community, we'll really need to be organized to say, where are those voices showing up, and how are we going to counter them as much as possible as well?
Thank you. Rachel, Craig, anything, or should we move on to the next question? All right, next one. So this is from Hamza. We know that the U.S. is a major donor to low and middle income countries. What actions should be taken upstream to minimize the impact of a reduction or even a complete cessation of American financing that could possibly arise, especially on community health aspects? Perhaps, Craig? No.
Hamza, it's a very sobering question, okay? and the way you framed it is very sobering. I will say this, and my colleagues can and choose to counter me if you don't agree. The likelihood that the U.S. government will, seize all of its foreign assistance or reduce it significantly is fairly low at this stage, because foreign assistance is used as a real key power in terms of advancing the U.S. government's diplomatic and economic interests as well. So I would just start with that's the position. I don't think foreign aid is under threat. What's under threat are the conditions that will be imposed on that foreign aid and what you can and cannot do with the funds received. And I think that then affects the work that is being done at both the community level and at the national levels to advance progressive reproductive health and rights policies worldwide as well. So I think that's what's going to get under threat. And we may also just see a larger imposition of anti-science, things that we know scientifically from good public health science work, and we may see a pushback on that. Programs for young people being focused on abstinence only rather than them getting the full range of services that they need. A pushback into, like we did under George Bush, a pushback into saying that we can only distribute, what would they call the ABCs, okay? Abstinence, behavior, change, and condoms were the only things that were allowed, and that sex could only take place inside a marriage. So that kind of stuff is what we are anticipating coming through more significantly. I will also say that, at least based on the past, I do not recall personally, and I don't think in our documentation, that community health programs were directly affected. The U.S. government, again, continued funding and supporting community health programs because it's seen as a really critical component of the expansion of primary healthcare access worldwide. But then what community health workers could and could not do with the funding that they were receiving was what was put at risk. I'll invite Rachel or Craig if you won't share anything, but that's at least been my understanding of the work that we've been able to get done.
Thank you.
There's certainly discussions going on about changes in the way that incoming Trump administration might do foreign aid, different modalities, different emphases. But I think, at least in the short run, funds will continue to flow for foreign assistance. I guess one thing I would look to is to see how Congress resolves the fiscal year 2025 appropriations process. I would just remind folks that with regard to family planning and reproductive health assistance, while it's not an ideal situation, we have been able to maintain family planning reproductive health assistance at the same level for the last 14 years. Despite having hostile Congresses and the first Trump term in the White House. So we fully anticipate that that in the first budget request from the Trump administration, that they may do what they did in their first budget request during the first term in terms of zeroing out all funding for family planning and reproductive health. I would put it as, probably a 50-50 probability. But at the end of the day, our champions in Congress were successful in restoring funding to the same level from the prior year. So, as Rachel said, the circumstances aren't identical to back during the first 2 years of the Trump administration in 2017 and 2018, but there's reasons for optimism, I think.
Thank you. We have a technical question, which I think, Craig or Rachel, you can, tackle. Will the global gag rule apply to, assistance from U.S. philanthropies going to CSOs outside of the U.S.?
I think it remains to be seen what the global gag rule is going to look like in its new iteration. In previous iterations that Craig, jump in. I think we don't want to anticipate anything or sort of fearmonger here, but there have been discussions about applying the gag rule to US based organizations. We don't know for sure what that's going to look like, and so I would say historically no, but
it may affect the ability of foundations to fund certain things in terms of finding organizations willing to do abortion-related services or abortion-related activities. One of the most insidious aspects of the global gag rule is that it affects it because of the outsized amount of funding provided by the U.S. government tends to purchase up, if you will, organizations and force them into a choice between taking U.S. money or surrendering their ability to do privately or non-U.S. government funded abortion-related activities. So I think it will have an effect on the ability of foundations to choose the partners they wish to work with in certain areas. The other aspect of the global gag rule is that's really harmful is there are organizations that are essentially the only game in town in certain geographies, and if they choose not to accept U.S. government money, those services in those areas are dramatically affected.
Thank you. So we have two questions that are kind of related to each other. I'll start with the first. How can organizations not based in the U.S. Push back against the global gag rule if they can? And if we don't have a direct, we have another question. So our partners from Social Watch Benin said, considering the critical situation in the U.S. and the threats to assistance that they're getting, what can they do for to keep up strategic communications? There's already kind of a lack of funding for communications focused work. So considering that there might be even less, what can they do to keep up those particular activities?
Okay, those are both difficult questions in some ways, and so no, we don't have any. I would say no easy answers, but referring back to what we're pointing out, do keep the USAID and CDC missions aware, using facts, using numbers, using direct about the consequences of the imposition of the global gag rule on communities, on people. Use numbers, use stories, really drill it in that this is harmful public policy practice, and it results in an increase in mortality and morbidity, and and a decrease in life choices for, especially for young people, when they have unwanted, unanticipated pregnancies as well. So I think we really need to drill that over and over again, but to make it as fact-based as possible. So people, it's real. These are the numbers. These are the people who are being affected, because the narrative on the other side is that the global gag rule, quote unquote, saves lives, right? And that's not true. And we know that, but we need to then counter that narrative with a very strong narrative about how it harms lives and how it actually kills more women and more people out there as a result of the policy as well. And that, I think, will have to be a consistent practice. We can't assume policymakers or people who are policy implementers know the consequence, fully understand the consequences of their policies as well. I think that's something I say. I mean, while knowing that this government and the people who are currently representing the Republican Party have a very strong stance, I think we need to have a strong stance back as well about the effects. So I think that's one piece. Our colleague from Benin has asked a much more difficult question, right? So it's about, because it's all the part of from my poor French, what I'm also picking up is, how do countries that are small like Benin continue to advocate for funding when it's already a country that is often put aside, left aside? And I think what Benin can really work on as well, and has been doing a fantastic job, is it has some of the most progressive reproductive health and rights laws in the world. And it has some of the most progressive laws in Sub-Saharan Africa for sure. And to use that, to drive that to go to progressive countries which are willing to fund to progressive organizations. Given the size of the population of Benin, I think there's a lot of possibility there about continuing to find the funding to maintain its progressive policy landscape, policy and implementation landscape as well. But agreed that this is not as easy. It's more easily said than not. But just want to make sure I believe I've captured that part of the question well enough as well. Okay. Thanks.
Thank you. Yeah, I would also agree that getting both the quantitative numbers of the impact, but also the stories and getting the qualitative are both really, really important. So thanks so much for that, Mustafa. Another question is, we're still even uncovering the impacts of the policy when it was in effect previously. When can we anticipate this fully being implemented? And then, when do we expect to see the impacts of the policy in real time? So, for anyone who would like to take that one. Maybe Craig on when we can start to see it actually being implemented.
As we discussed previously, it will take a number of months for the policy to be rolled out. And then, assuming that it's implemented in the way it has been implemented in the past, it will the application to individual programs and organizations will take a while, because it won't be enforced upon organizations until there's a new funding agreement or a addition of additional funding to existing agreements. The fact that it was done that way in the past doesn't necessarily guarantee that that's the way it will be implemented this time. But I'm not a lawyer, but it seemed to me that that's really the only way you can do it, that it would be difficult from a legal standpoint to claw back previously obligated funding to organizations. And Mustafa's more knowledgeable about program management and implementation than I am, so maybe he has something to add on that.
Yeah, I agree. I agree with you. I think it's hard to claw back. However, once the rules are imposed, they're imposed. And so moving forward, even if you already have money in the, during past reimpositions, money had to be taken away from those organizations that had not signed the global gag rule, right? So they had some very immediate cessation of programs that occurred once the rules came down the line as well. I think if a prime implementing partner says, signs off on the global gag rule and chooses to impose it on itself and on other subrecipients, then there's no disruption of service. The money is not reduced. It's available. It's in the pipeline. It's already obligated. However, it does affect those organizations that take a stand and say, no, we're not signing the global gag rule. Our mission is very clear about people having full access, access to the full range of reproductive health and rights services and information. And I think that then can result in some severe disruptions for those organizations. I think we're saying the same thing. It's just about two sides of the equation. It does affect some of those commitments.
Thank you. So we are at time, and I want to be respectful of people's days. A lot of folks use the Q&A to thank all of you for providing this information. I agree. Thank you so much. And as Mustafa mentioned earlier, PAI is going to continue to watch this, provide analysis, and as always, we serve as a resource to help you navigate what is going to be coming with this new administration in Congress. So again, thank you everyone so much for joining. Thank you to our speakers, and we'll get through this together. So thank you.